Imagine navigating a healthcare system where every step feels like an uphill battle. What if your access to essential medical care was threatened by new regulations? Today, we're exploring the profound impact of Medicaid work requirements on individuals who rely on this vital support. Let's start with the story of one patient, a man whose life is a daily struggle due to scoliosis, relying on a wheelchair for mobility. Recently, he faced a dire situation after a bus accident, with his survival depending on timely medical intervention and Medicaid coverage. His experience underscores the critical role Medicaid plays for many Americans. However, with new work requirements being implemented, individuals like him might soon lose this crucial lifeline. While the aim is to reduce waste and fraud, the cost could be significant. Nearly 12 million Americans might lose their insurance by 2034. This isn't just about numbers, it's about real people facing real consequences. Consider the barriers beyond the hospital. For my patient, accessing Medicaid was already challenging due to living in shelters without a fixed address or cell phone. He's not alone in this struggle. Think of the father who needed interpreters to understand his medical condition, or the woman battling addiction while malnourished. These stories highlight obstacles that extend beyond physical ailments. Language barriers, memory deficits, or simply the lack of internet access can all impede access to care. Reflect on this. How would you navigate such systems if you were in their shoes? With work requirements in place, many will be unjustly removed from Medicaid, despite qualifying for exemptions due to disabilities or other valid reasons. The time tax, a term describing the mental and bureaucratic burden, falls heavily on those least equipped to bear it. The changes will have a ripple effect on communities, especially in rural areas where healthcare options are already limited. Hospitals serving low-income patients could face financial ruin, further reducing access to critical care services. It's a vicious cycle. Legislation intended to save money ends up costing more in human terms. As Annie Lowry aptly puts it, the time tax falls disproportionately on those least likely to possess the connections, education, or resources. This quote encapsulates the frustration felt by many who must navigate these bureaucratic mazes alone. It's not just about numbers, it's about dignity and access to necessary care. The proposed cuts, slashing approximately $1 trillion from Medicaid, are not just figures on paper, they represent lives interrupted and healthcare denied. This is particularly true for those working poor who juggle multiple jobs yet still fall through the cracks due to these requirements. As we consider these changes, let's ask ourselves, are we comfortable with a system that prioritizes cost-cutting over compassionate care? The narratives from our hospitals tell us that healthcare is not just about treating ailments, but also about supporting lives in their entirety. As we move forward, reflection and action are essential. Policies will continue to shift and evolve, and it's crucial that we advocate for those whose voices often go unheard, the ones caught in the crossfire of legislation designed without their realities in mind. In this complex landscape, how can we ensure that compassion remains at the heart of our healthcare system?